In 2022, the World Stroke Organization reported that stroke is the #1 cause of disability worldwide, and also that stroke is the #2 cause of death worldwide. They also reported that 1 in 4 people will experience a stroke in their lifetime. So we can see how important it is for us all to know about stroke. There are 2 types of stroke. The first, which is the most common, is called ischemic stroke, where a blood clot blocks an artery to the brain, and so blood flow is reduced to part of the brain. Number 2 is called hemorrhagic stroke, when a blood vessel inside the skull bursts and bleeds into and around the brain. Looking at the above statistics, it is important for us all to know about stroke. We heard that 1 in 4 people will experience a stroke in their lifetime. So what are the predisposing factors? What really should we do? What are those factors that we should look at? The first factor is age, which, as you know, we cannot do anything about age. We all are getting old. But as we get old, blood vessels harden, and as they harden, blood flow to parts of the body is reduced. So age is a factor. As you grow old, then you should really look after yourself so that you are not predisposed to stroke. The second factor is overweight. Now, if you are obese or overweight, you should try and reduce your weight because this predisposes you to stroke. Another factor is smoking. Those who smoke, because nicotine has been found to harden the blood vessels. So we need to reduce or not smoke at all. Another factor is increased or alcohol intake. This is something that we should all take into account because it predisposes us to stroke. High blood pressure, which is sometimes called a silent killer, is another factor. So it is important for everyone to make sure that they have their blood pressure checked on a regular basis so that they know where they stand. Another condition is diabetes. And one of the most common factors is stress. We know in life there are so many causes of stress, but we need to deal with stress. If we don't deal with stress, it will predispose us to having a stroke. Let's look at stages of recovery. When you experience a stroke, or when a person experiences a stroke, there are stages that one goes through. The first stage is flaccidity. This stage is when the limbs are completely limp. They cannot be moved because there's no blood flow going to those parts of the limbs. So the individual is unable to move their limbs completely. The second stage is when some blood flow is going into the brain cells, and so there are now some jerks, movements that the individual cannot control. And then we move on to when someone is now able to carry out complex movements like brushing their teeth or using a spoon to feed themselves or writing and even walking. And this fourth stage is when one is completely recovered and they are back to their pre-stroke condition. Now, we went through the stages of recovery, and in most cases, when the individual has started to recover, they are usually informed that now they can go home and be cared for in the home. But when they get to back to their homes, usually there are very few people who have information about how to care for their loved ones. So these tips are for caregivers who have some knowledge, but not a lot of knowledge about how to care for their loved ones in the home. The first tip is that when you are told that your loved one has experienced a stroke, you have to now start looking for information. Educate yourself on the condition. Educate yourself on all the information that you can get hold of on stroke so that you are able to care for your loved ones properly so that they can recover quickly. The second tip is that you need to give your loved ones emotional support to recover speedily. Stroke is a very stressing condition because 1 minute you are able to carry out your day-to-day activities and then all of a sudden you are not. And that's very frustrating. And it is also depressing, and it is also makes you angry. So people who have experienced stroke will need a lot of emotional support from their caregivers. Another tip is that you should encourage your loved ones who have experienced a stroke to exercise as much as possible. They can use the limbs that are not affected to support the limbs that are affected so that they carry out passive movements while they are sitting down or while they are having a discussion or when they are just trying to watch television or do whatever activities that do not need a lot of effort. They should be encouraged to exercise as much as possible. But while they are exercising, it is tempting for the caregiver to do most of the activities for this loved one. So it is encouraged that we should be helpful, but not do too much for the loved one because they need to recover. Without exercise and with us doing too much for them, they will not recover speedily. As we are talking about exercising, here's an example of someone who has been affected by stroke can exercise.
Kusuza moko we-left uchibatsirwa ngewe-right saka ndiriusunza kuti unozvirwadza asi unoshingirira very good ndichiita kuti udai kuerenga zvakurwadza wodzikisa toitazve ndokwizazve mudenga good kuzvisa basi magona sekuru magona
Another tip that we can talk about is that the caregiver should know about the medication and the side effects. It is important to know the side effects of the medications that are being given to the loved ones, because the caregiver can then go and report to the medical doctors so that the medication is adjusted accordingly. An example is if the person is unable to sleep and they are given medication to help them sleep, and then they are now sleeping more times than when they are awake. This is when the caregiver should now go and report. So knowing about the medication and side effects is paramount. Another tip is that we should avoid our loved ones having falls, or prevent falls as much as possible. It is also important for this carer to be as positive as possible. We use encouraging words like, well done, well, this is beautiful, you are doing very well. This is very encouraging because the person who is affected with stroke will feel motivated to continue to do well. Now, the next is that we should be observant that our loved one is not experiencing another stroke, because it is possible that one can have a second or third stroke. While we are looking at ways to identify whether someone has experienced a second or third stroke, we can use the mnemonic B FAST, BEFAST. B stands for balance. If there is reduced coordination in the limbs or in the legs or wherever, then there is a possibility that a second stroke might have happened. If the loved one who has had a stroke, recovering from stroke, reports that they are now having blurred vision when before they were able to see clearly. The F, when the face becomes droopy or there's difficulty in smiling. And then the A stands for pain in the arms. If the loved one reports that there is pain in both arms. Then the S stands for speech, when there's difficulty in speaking or understanding speech, when before the loved one was able to communicate well. And the T stands for time. There's no time to waste. When you identify or observe the above, this is the time to seek emergency assistance or take your loved ones to hospital. Very satisfying and rewarding. But we need to have tips for the caregivers to look after themselves. It is important for self-care for the carer. Now, as I said, it is rewarding to care for a loved one. We have had people joyfully telling others how they looked after their parents, how they looked after their husbands or their wives when they experienced difficult situations or when they were ill. It is very, very rewarding. But it can also be very, very stressful. So the carer should look at signs of stress, because when you are stressed, you are not now useful to. It is important for you as the caregiver to look for signs of stress in yourself. Now, stress presents itself in different ways. You can become very angry. You can become very impatient. You can become very short-tempered. You can even get to the extent that you start ignoring the calls of your loved one. This is sometimes called burnout. So it is important to avoid burnout. And as a carer, you should try and ask for and accept support from other family members. You need to join a support group so that you can share your experiences and hear how others are caring for their loved ones. And above all, as a caregiver, you need to make sure that you are having a healthy diet, you are having adequate sleep, and you are having regular time off. And here, the family should be able to support you. When you take time off, someone else can come in and look after your loved one. One of the signs of getting stressed is called compassion fatigue. When you no longer have any compassion whatsoever, and it's as if you are completely exhausted yourself. There's a saying that love is not love until you give it away. So the carer will be giving love to their loved ones. And it is important to include the whole family so that they participate and sharing the love. And this will make sure that your loved one who has experienced a stroke will recover speedily. This was given to me because I shared love.